Hi, Dr. Bill here with number 4 in our Dr. Bernie Siegel's series based on his book Love, Medicine, Miracles, and also his methods that he used in treating his patients, that even though he was a surgeon and he performed surgery, he also had a method that he taught to his patients, whether they were having surgery or not, to help them with their problems. And Bernie Siegel became very famous, and that was quite a number of years ago, and he's been around for quite a while. So when he first began to use these methods and present them to his colleagues, he wasn't very popular. They rejected his methods because obviously they had their way of doing things and they didn't want to change that. There's probably a number of reasons. So as in our previous series that we've been doing, I've been reading to you some excerpts from his book, and I will do that again. And if you want, you can look at the text and follow along with what I'm going to read to you now. And I begin to help find out whether you have the outlook of an exceptional patient right now. Ask yourself this question before reading further. Do you want to live to be 100? Yes or no? In exceptional patients, we have found that the capacity to be an exceptional patient is accurately predicted by an immediate visceral yes, with no ifs and no buts. Most people will say, well, yes, as long as you can guarantee I'll be healthy. Now, that's pretty in your face. So I probably need some qualification. He does say that if you have the outlook of an exceptional patient right now, so it doesn't mean you can't change. So if you didn't answer immediately yes to the question, regardless, then it means, there's probably some room for improvement. If you're putting a condition on it, which is understandable, I'd be the same. But we need to realize that we can all improve in our outlook as to how we see ourselves and how we see life. So again, continuing on, physicians must realize that the patients they consider difficult or uncooperative are those who are most likely to get well. Isn't that strange? Psychologist Leonard Derogatis, in a study of 35 women with metastatic breast cancer, that means it had spread to other parts of the body, found that the long-term survivors had poor relationships with their physicians, as judged by physicians. So again, we have to try and understand the implication of both those things that I mentioned. So if you're challenging your physician, if you're wanting answers, if you want to be educated, if you want to be part of your treatment, your therapy, if you want them to work with you, then it's likely that you'll be encountered as being difficult, because it's much easier for them just to do their thing and not have to educate you or answer all your questions or all of your challenges, why this, why that. But he also mentions in his book, which I haven't quoted there, that often the passive, easier to get along with people often don't do so well because they just accept things. So we have to fight for what it is that we want. We have to take that responsibility, and again, if you don't feel that that's in your nature, you can learn from that. So two things which I wanted to point out from those quotes that I mentioned is that don't be afraid to challenge your doctor. Don't be afraid to challenge anything that you're not sure about or you want answers to. And if your doctor doesn't, then obviously you've got to find someone who's prepared to work with you, who's prepared to actually to team up with you and allow you to make the decisions yourself. Unfortunately, for a lot of professionals, they don't like that. Now, I'm not here to bag doctors or to give them a bad reputation. I'm not here to do that. I think they do a wonderful job in very, very difficult situations. It's not easy, but you have to take responsibility and you have to make sure that you have a doctor that's prepared to work with you. They may think they know what's best, but what they may not realize is that you need to be empowered to actually take that on. And the other one that I mentioned was the fact that whether you are one of these 15 to 20% of people who the odds are in your favour, that if not, you can learn what those characteristics are and apply them, such as what we've talked about in our series so far, and which we will do in the next two series. And then, of course, you can also get Dr. Bernie Siegel's book or his books and learn from yourself. And, of course, there are many other things. So this is Dr. Bill signing off. I'll see you on our next series. Thank you. Bye.